Hello and welcome back. I'm Dr. Barbara O'Neill, and today we're diving into a topic that affects many of us, allergies. If you've been struggling with sneezing, itchy eyes, or skin rashes, understanding the causes and finding ways to combat these symptoms is crucial. Allergies occur when your immune system overreacts to normally harmless substances, known as allergens. These can range from pollen and dust to certain foods and pet dander. Knowing what triggers your allergies and how to manage them effectively can make a significant difference in your quality of life. So stay tuned as we explore the common causes of allergies, how they impact your body, and practical strategies to reduce your exposure and manage your symptoms.
The most common allergens are wheat, dairy, and refined sugar. Dairy milk is excellent milk for baby calves. Got that? Baby calves. And if you give a newborn baby calf the milk in the supermarket, did you know that calf will die? Now it is true that some people have in their heritage dairy. So if you've got a 5th or 6th generation dairy farmers, they usually can handle a little dairy, but the dairy they can handle is the raw milk straight from the cow. But the milk from the supermarket, I don't know whether anyone can really handle that because it has been altered. And the reason pasteurization happened really was because of dirty dairies. My daughter lives in Wisconsin and she lives opposite a dairy farm, and she said the dairy's not very clean. And what happens is, if you go, it's a bad smell, and they put those things on the udders, to get the milk out, and sometimes the udders would fall on the floor and there's manure on the floor, and they just put them on the next udder. Eventually, after about 10 years, they did test the milk and found E. coli in the milk, and the dairy was closed down. Down the road, there's another dairy, and it's spotlessly clean. You could actually eat off the floor in the dairy. It is so clean. And yet when the milk truck picks up the milk, what happens? It all gets thrown in together. My friend is she lives in Africa, and she has her and husband have an orphanage, and they have a couple of hundred orphans, and they started getting babies because a lot of parents died, a lot of mothers died from AIDS, and they found that the babies went well on the soy milk. But there was a group of babies that were not doing well, and it was the Maasai babies. Because what do the Maasai eat? The Maasai eat, they eat corn, but they also eat a lot of meat and milk and blood. And the lady said, I don't know what I'm going to do with these babies, and her husband saying, I'm getting a cow. They got the cow, they milked the cow, they gave the cow's milk to the baby Maasais, and they flourished. Because the Maasai have in their gut enzymes that break down the dairy because they've been eating it for thousands of years.
Type 1 diabetes can occur when the immune system attacks insulin-producing cells in the pancreas. This may be triggered by factors like dairy consumption. Proteins in cow's milk can sometimes confuse the immune system, leading it to attack the body's own cells. While some people tolerate milk well, others with sensitivities or a family history of diabetes may be at higher risk. Introducing cow's milk early in children with such history could increase their chances. Being mindful of dietary choices and watching for signs of intolerance is crucial for health.
What about the eczema, and what about the asthma? See, when a body cannot handle the cow's milk, one of the ways the body reacts is creates a lot of mucus. And it creates a lot of mucus in the eustachian tubes. And are you familiar with your eustachian tubes? They connect your ears and your mouth and your nose and your eyes. So a lot of mucus is created there, and then congestion builds up in the chest. There's your asthma. These are the children that have to have their adenoids out, their tonsils out. Do you know what your tonsils are? They're the watchmen at the gate. They're just saying, hey, there's a problem. Oh, we'll just take out the watchman of the gate. We're sick of their loud cries. Now, what's going to tell the body that there's a problem now? You see that? Now, what unfortunately is not often addressed in medicine is this. Why are the adenoids swelling? Why does the asthma keep returning? Why are the tonsils swelling? I get a few emails. Barbara, what can we do for tonsillitis? So I say to them, the first thing is you must stop the dairy and the wheat and the refined sugar. But a word of warning here, it can take up to 2 months before the full effects of stopping it are seen. So a person can eat a slice of bread and it'll be out of the body in 24 hours, but the effect can remain for up to 2 months. One lady said, aha, she said, I stopped for 2 weeks. I didn't see any difference. So she said, I started up again. And one lady said, well, I stopped the dairy, that didn't seem to make a difference. So I went back on that and stopped the wheat. So it all has to be stopped at once. And what I say to people is, don't stop today. Don't stop tomorrow. You've got to go home and seriously assess the kitchen cupboards. Seriously assess the fridge and the freezer. And then you've got to make those adjustments and then start. Otherwise it's too hard. You come home, you're hungry, open the fridge, bread, pasta, everything that you actually don't want to eat. And did you know that hunger is the strongest urge in the human body? And so some of your senses go out the window and you just want to eat. You see that? So it's a good idea to make the changes before you actually take the step. So that's one of the reasons why dairy causes so many problems up in the respiratory, because of the excess mucus that it creates. Did you know in China, tonsillitis was unheard of? Adenoids going out, unheard of. And now, in the last 20 years, the Time magazine says that China's now eating the meat-sweet diet. What's the meat-sweet diet? Very typical to the typical Australian or American diet, which is a lot of meat, a lot of dairy, a lot of sugars, a lot of refined things. Do you know those Chinese children are now getting tonsillitis, adenoids, eczema, asthma, things that were not known of, hardly. And yet now that these are being introduced. And when you think of it, how many Americans have cereal and toast for breakfast, sandwiches for lunch, coffee with tea, coffee with milk, tea with milk and sugar and biscuits. You know, I think the Australian and the American diet in many ways are similar.
The global shift to diets high in processed foods, dairy, and sugar is affecting health worldwide. Countries adopting Western eating habits like China are seeing a rise in conditions like asthma, eczema, and tonsillitis, which were less common before. Traditional diets, often plant-based and low in dairy, helped avoid many of these issues. Overeating dairy and processed foods can increase mucus and weaken the immune system. Reducing or cutting out dairy, refined sugar, and processed grains can help prevent or manage these problems.